So what I want to know is what impacts have this challenge or reduced staffing shortages had on inmate medical services? What kind of impact has your shortages had on inmates?
Just to confirm, you're asking like what? We have an outside vendor that does the healthcare, so we like the relationship we have with them is, I think, fantastic, and so we're still like that hasn't been changed by the staffing levels.
Well, let me give you an example of the question I have.
Yes, sir.
So let's take someone that is in need of medical care.
Yes.
Okay, I know there's processes, there's procedures that have to be followed there in terms of how you have to have someone, you have to have an officer.
Yes.
There because of that. So with this shortage, what impact does it have on an inmate that's in need of emergency care? In other words, how long does it take before you have a shortage to get to an inmate when they had a need for medical care? Emergency.
Yes.
And how much time does it take now that you're in the shortage situation?
Well,
Because the concern I have is I'm pretty familiar with, I have relatives that are type 1 diabetics, and I know what that's all about. I've seen it.
Mm-hmm.
So the question is, how much time is added to that care time?
Well, we're supplementing staff, especially when we talk about medical care, with overtime deputy. We brought people out from on the streets, patrol people, to come in and help supplement that. So like as soon as we need to get to, someone's emergency care, we have supplemented the staff we have in the jail with people we have from the streets to enhance it. So we've committed to like making sure that we get that care immediately. And so I would say that there hasn't been a reduction in the emergency response.
How does it take?
It just depends on the particular case. But like, for example, if they get a call and say, we need an escort to be on the transport and go with someone to medical care, I mean, it's minutes, less than 15 minutes that we have someone there.
At some point, I'd like to know more about that.
Sure.
I see the shortages adding to the care of the inmate in emergency situations. And the last question I think I have in this particular area is this act of medication distribution.
Okay.
So, what kind of impact have you had on the ability to distribute medications on a timely basis to the inmates due to the shortage?
That would probably be something I have to get back to you on time-wise, unless you have something, Chief.
For your first question, like diabetic, not just diabetic, but most of those end up in a specialty unit where nurses are in or on the floor repeatedly with officers. So there's not really a delay for a lot of those exigent. Switching to medication distribution. Again, so the pharmacy staff, independent of us, has the ability to go up on floors if they need a specific officer to accompany them. So for medical distribution, I wouldn't believe there is a delay.
Well, let me just end with this. What I want to know more about in the medical area is when you have shortages, something's going to give. It just does. And so what I want to know is what has been suffering as a result of the shortages in the medical area, in particular areas of emergency care, and also in the area of medication distribution, particularly with inmates that have almost an immediate need for their medication. Mm-hmm. And what I don't want is to have an inmate denied receiving a medical prescription.
Yeah, absolutely.
Today, because we're having a peak, we got to wait till tomorrow, and the inmate's up. We get work.
Yeah, that's 100%. Yes.
That's tracked completely different via not Dr. Borson, but via medical records in the carts.
I want to get into that more as we go forward.
Absolutely.
Those are the kind of questions I'm going to have.
Yes, sir.
would you find it beneficial if we brought a medical director from the company next commission meeting? We can prime them with what you're looking at, but they would be able to go into more
I think it would
detail.
help.
Okay.
Where we can ask questions, because this is our first line of care and inmates that are in custody. When someone has medical issues, you've got to take care of that business.
Well, I can tell you, we far exceed the 1.5-page medical screener that's prescribed by jail commission. We get extensive medical mental health treatment up front before they in our processing building, more than I would say probably anywhere else in the state. And I've been in pretty much every other jail in the state.